Hi, everybody. This is Lee Howard from Diana T. Myers and Associates. Thanks for joining the COVID-19 office hours this afternoon. I am thrilled that Donna Enrico is able to join us today. If you'll remember last week, she was also joining us, and apparently Skype all over the country or in several parts of the country sort of just stopped working. Sorry for that technical glitch. Obviously, we had no control over that, but glad you were able to join us again today, Donna, and we're thrilled to hear more information about the resources available through the CDBG program. Next slide, please. So in addition to Donna, we're going to have some information to share in regards to HUD's May 22nd memo. If you are a recipient of COC funding, hopefully you've already reviewed that information. And if you have questions, this will be a great time to pose them. We're going to talk a little bit about the expedited grant process and hopefully hear some stories from you all about reopening and talk about some new resources as well. So with that, I'm going to turn it over to Donna. I know she has about a half an hour or so to be with us today, so I want to make sure that we get to maximize her time. So thank you again, Donna, for joining us for these office hours and coming on to share information.
Good afternoon, everyone, and thank you so much. Lee, I'd like to say that it was all that brain power that was on the webinar last week that made Skype go down. That's how I'm going to look at it.
That's a good way to look at it.
Because honestly, I'm not that person who is, technologically savvy. And I thought I had hit something, although my hands weren't on anything. And I thought I was the one that disconnected. So I was very happy to hear that everyone else got disconnected at the same time, and it wasn't me. So I'm not sure where to start. I don't want to repeat a lot of things. So I think one of the good things that came out of the epic Skype fail was that it gave us an opportunity at DCED to listen in on a HUD briefing Friday afternoon. And so there were a couple little tidbits that I'll be able to share from HUD's presentation to us that I think will be helpful. But I'm going to quickly just go over the department's program, Tranche 1 quickly, and then we'll talk a little bit about Tranche 2. And then I want to spend some time, because I think all of you were interested in really talking about some of the activities that could be funded. So as I said last week, Pennsylvania will be receiving in their Tranche 1, this is the original, the first one, $24,691,407. Now, because that came through the Community Development Act at the federal level, DCED has to allocate that according to the state statute, Act 179. In essence, what that means, there are certain municipalities within the Commonwealth who receive a small annual allocation from DCED of these funds. So these local governments will contract with DCED. They must hold hearings to solicit input for activities, projects. Ultimately, the municipalities set their priorities. So that's one thing for service providers to keep in mind, is that if you want to take advantage of these funds, you really need to reach out to your units of local government where you provide these services to participate in their public hearings, to let them know what you believe are some of the needs out there due to the COVID-19 pandemic. So out of that first formula set aside, 85% of those funds go to those small entitlements. We do have a competitive set aside. 12% of those funds can go towards other projects, but again, we must contract with units of local government. So if you have a larger project than what the local municipality is receiving in funding, you can also petition them to come in for a competitive set aside. So basically, eligible activities, HUD has been saying, I mean, they put out a quick guide, and that quick guide had alluded to doing public facilities, public services, some planning activities. But HUD has come back and said they will consider any eligible CDBG activity as long as we can make the tie to COVID-19, that we are preparing for, preventing, or responding to COVID-19. So in the public facilities, we've gone over where testing sites, neighborhood clinics, things of that nature. Public services, again, anything that is a service that is provided out there, and in the HUD guidance, there are many, many services. So think about how the coronavirus has impacted your services that you're providing. If we can make that tie, then it's probably an eligible activity. And then, as I said, economic development. I forgot about the economic development piece. That was another big piece in the initial guide, is to help small businesses that were impacted by those closures, people losing jobs, that we can also provide some economic development assistance to help those businesses rehire, to bring back people who have lost their jobs. So that's a small part of the CDBG program. The other piece is this meeting a national objective, which means HUD, their programs prioritize meeting the needs of low and moderate income persons. They are not wavering on that requirement, and we have heard it several times. So we know that they want most of these monies, at least 70% of the funds that they have given out under the CARES Act, the first tranche. We believe it will impact the second tranche as well. 70% of those funds must go towards activities that are going to assist low and moderate income individuals. We believe that we'll be able to use in certain areas an urgent need national objective, but I do have to caution, we're still waiting for guidance. The Commonwealth, DCD, the office that administers those programs, we do get on sessions just like this with other states, and it's interesting to hear some regions of HUD are dissuading their states from using urgent need, and we're fighting hard to say we believe it needs to be there. And basically, we're waiting for HUD to give us a little bit more guidance on what their expectations are for it. But we do believe we'll be able to use it in some circumstances where we can't meet the benefit to low and moderate income persons. So to talk a little bit about the second tranche, and then I'll get into some of these specifics on public services. The second tranche of funds that the Commonwealth is receiving, we're getting an additional $51,352,198. Those dollars, the second tranche, basically went to states around the country based on needs and some other demographics. So as you can see, Pennsylvania received quite an amount there. These monies, we're still waiting for HUD to give us some guidance on it, but DCED right now is actively engaged with some of our sister agencies on data that they have, needs that are presented to them. We will be developing priorities in order to allow for these funds to go out in an application round, but we need to wait for the Federal Register notice. Also, DCD will be required to have a public hearing as well. And so we will get that information once we've established a date for that hearing. And again, it will be to solicit needs and priorities that folks believe are out there across the Commonwealth. So that information, we have many contact lists, and we try to make it as broad as possible, getting it out to everyone so you folks would get that notice of when that hearing would be. And again, we don't see much changing on the eligible activities, the national objectives, those types of things in tranche 2. But again, we need to wait, and so we're anxiously waiting. So on Friday, HUD, we got the information directly from headquarters. The director of the Office of Block Grant Assistance, Jessie Hanforth-Cohen, she basically is responsible for writing the Federal Register notice and has complete oversight of the block grant assistance offices. So she is a very reliable source, and so we decided that we were going to listen intently to what she said. And a couple things is that we do know that part of what the program says is we can allow for reimbursements. And she had stated that January 21st, I believe, was the first known case of coronavirus in the United States, and therefore reimbursement will probably be eligible back to that date, but anything previous, her words were, it will be scrutinized. So unless somebody can make a case for something back before January 21st, you're probably not going to be eligible for any reimbursements prior to that. She did speak to the Federal Register notice. She could not tell us where it is in HUD or whose review it is under, but she did say that it is going through the process and that it should be launched soon, as well as some guides. Because as we know, we started, I think, to talk about duplication of benefits. So they're going to provide us, the state, and we certainly will pass these tools down to anyone who is receiving the funds. But they will give us additional guidance on how we will deal with duplication of benefits with the CARES funding. There was a question of, and I don't really think it pertains too much to the audience that I'm speaking with, but as always, FEMA's getting some funds as well, and some of the FEMA funds require a 25% match from the localities. Our funds will be able to provide that 25% match. We always say when you're pairing up different sources of funding, whether it's ESG, COC, the CARES Act from DCED under the CDBG program, or any other department, you just have to make sure you're marrying all of the respective federal requirements together. So sometimes CDBG funds will have a duplication, or not a duplication, a Davis-Bacon labor standards requirements, where some other funding may not. You can't ignore it if you're going to use our funds, even if another funding stream does not require Davis-Bacon. If you put our funds in and it's a covered activity, you have to use the Davis-Bacon. So some of the examples that Jessie had talked about in explaining how HUD views some of these activities. So one of her things was to say, fund the activity, not the entity. And we tried to push her a little bit to kind of tell us, what do you mean by that? What do you mean by funding the activity and not the entity? So one of the programs that she said that they have heard of and they like is that nurses who for one reason or another cannot go home for risk of infecting other family members at home. She said to pay for the housing, do not give the money to the hospital. So you're really providing that opportunity to stay at a hotel, motel for somebody who's at risk, who can't go back to their homes because of their vocation. But you wouldn't necessarily give the money just to the hospital. So that was one of the types of activities that she had talked about. Another was, we talked about services for education for children in a learning environment, having to go to this virtual learning. And so again, one of her, and she had identified some types of things that I'm not aware of, but she called them lending libraries, where there would be Wi-Fi hotspots or laptops or tablets that children have access to, is that you fund that service. You don't necessarily fund the school or the individual directly, but you support those services. And in providing services, some of the things that she said we could do is that if you needed additional hand sanitizer stations, certainly that would be an eligible activity. If you had to upgrade an HVAC system for a better ventilation for some type of facility or an area where you have services, that she said would also be eligible. You know, we talked about a little bit about broadband, and again, providing hotspots in lending libraries so that folks would have the opportunity to do some virtual learning or to have access to Wi-Fi, renting Wi-Fi trucks. And I hadn't thought about this in the community development realm, but basically what they were saying there is that these are very similar to these huge trucks that provide Wi-Fi at large concert events, is that if that needed to be brought into the community, it could be brought into the community. And again, one of those things that we always have to, you know, we're talking about eligibility, you have to think on that back end too. Who are we serving, and can we meet that low mod national objective or that urgent need national objective? I know that we've also gone over subsistence payments, and we've been waiting for some additional guidance on these subsistence payments. Again, just because we're on learning sessions with our other states, and we hear there's been this, yes, we can pay arrearages, no, we can't pay arrearages. So basically that was put to Jessie on Friday. And she said that's still under, HUD is still looking to provide guidance on arrearages. And so it's still a little bit open, but as soon as we get that guidance, we're certainly going to give it to everyone to let them know. So we still can pay up to 3 months rent, utilities, mortgages. Couple things that, again, this is typically a HUD rule and interpretation of what they have said. So I'm just putting it out there because a little bit of it was confirmed. So we think about mortgages, paying for mortgages. A lot of times principal, interest, and taxes are included. Taxes go to the units of local government. Taxes would not be an eligible expense. Think about anything that supports the unit of local government. That's typically an ineligible cost under the CDBG program. So she did confirm that taxes are not eligible. Utilities, we have to just be careful with utilities, because in Pennsylvania, and I don't know about other states, but we have some utilities provided by the unit of local government. That unit of local government might own their electric company, might own their gas company. If they do, HUD is looking to put some guidance out on that as well. Can we pay it? Can we not? So I'm just saying, be cautious right now. If it's I believe if it's a third party like UGI or Pennsylvania Power and Light, those types of things, and third party entities, we would be able to pay those utility costs. But if it goes directly to the unit of local government, we must be cautious at this point in thinking through your activities. And I think that was a broad sweep of, you know, what we know right now. And I certainly do have time for questions. I don't know if I'll have all the answers, but certainly we will take them down and get answers as soon as we can. And like I said, the biggest thing for us right now is under the CDBG program is to wait for HUD to see what type of additional waivers they're going to provide to the CDBG program, or the relaxation of any of the rules that we now must abide by. Jessie did hint that there will be some additional flexibilities coming, but she did not say what those flexibilities would be. So I know that I have said in the past couple of weeks to our own communities that we are anxiously awaiting that Federal Register notice. And I said, my patience is running out by now, because I said that like 2 weeks ago and we still haven't gotten it. So we are waiting. We hope it's within the next couple of weeks, because, we'd like to get solid guidance out to everyone. So I think with that, Lee, if you're okay with it, we can open it up for some questions here, and I'll try to provide some answers.
Yeah, I think that'd be great. I guess with nobody else asks, do I sound normal?
Yes.
Oh, okay. I sound like a robot in my ears. With HUD during the webinar that you just referenced that occurred on Friday, did they provide any additional guidance around services to the homeless or public services that they were looking for? I know you said as long as it's sort of tied to what are the words? Prepare, prevent, and respond to COVID-19, then it would likely be eligible. But I know that's one of the things I asked last week. I don't know if they provided any more guidance on that.
No, well, homeless services, I mean, it is an eligible activity for us. And I think what everybody, and I thank you for that question, because it is one thing that I felt to strongly reiterate, is that when our grantees come in for these activities, we've been telling them, do not think that we're going to recall all the conversations that we've had with everybody. Don't assume we know anything about your program, even if we've talked to you about it. What you need to do is tell us what you want to do, how is it eligible, how do you meet a national objective, and then more importantly, how is it tied to the coronavirus? And so it's easier for me, because my wheelhouse is not services, it's more bricks and mortar. So for instance, they had talked about, we've got to widen some sidewalks for the community because of social distancing in certain areas, because you don't want people walking up and down, the street and being right next to each other. You've got to provide that distance. So thinking about if you have homeless shelters and you need to make some renovations to provide for that social distancing, I think that that's really going to be, now while that again is bricks and mortar, it is providing that service to the homeless by being able to have them, housed safely there. If you have to expand and provide that by, hotel, motel, I think the difficulty becomes that there's a lot of homelessness money out there through the Emergency Solutions Program. So you have to kind of make sure that we're not paying for the same thing at the same time, that it has to be somewhat separated out.
Got it. And for folks who haven't heard you speak before or haven't reviewed the information from HUD, can you talk about any sort of match requirements?
Oh, sure. So under the CDBG CV CARES Act funds, there are no match requirements, Some of our communities may ask for leverage locally because they like to see some skin in the game locally. It's not required by DCED, and our units of local government are able to set some of their own rules. But I have to tell you, that is a very rare thing that happens. And given the circumstances, I would doubt that any units of local government are going to ask anyone to leverage funds at this point. And like I said, the only match is if somebody has FEMA dollars that is an eligible activity under CDBG, CDBG, can provide that 25% match, so it does not come from the locals. Is that clear?
Yep.
Okay. And then I think as I said, the other thing that I want everyone to know, because I know there are entitlements on this call as well as DCED, small entitlement communities, that second tranche of funds that came to the state, it is, every community in the Commonwealth will be eligible for funding under there. We just don't know how. It is to address the needs in those local governments statewide. So in that second tranche, entitlements as well as the non-entitled areas will have some sort of access to those funds. We just have to set the priorities and the application process.
So if I understand the main difference between the first and second allocation, it sounds to me like in the first allocation, units of local government will be setting their priorities because 85% of the money will be going out to them through your small entitlement allocation. And the difference is that with the second round, you guys are setting the priorities. Is that a fair way to describe it, or were there more nuances that I really missed?
No, that's a great way. We term it a method of distribution. The first one, the method of distribution, has to go with Act 179. The second tranche, DCED, will determine that method of distribution. We have to have public hearings, just like our units of local government, and we have to have partnerships. How did we determine, working with our sister agencies and other agencies throughout the Commonwealth, as to where those needs are, what those needs are, and then, like I said, the application will be prepared and released, and that's when we will know exactly, you folks will know exactly how that will happen.
Got it. I know Don only has a couple more minutes. Anybody else have questions that they want to pose? Anybody trying to get in touch with their local ESG partner and having a hard time figuring out who that is? Anybody want to invite Donna over for dinner once it's safe and pick her brain? If I knew how to do a hand raise on that, I'd do it myself.
Well, listen, we're always here. And as I said, you have I don't see it up here, but my email is very easy. It's just denrico@pa.gov. But certainly any questions or thoughts that you folks might have as you think through this, as you're having more of these sessions, please just get those to Brendan. I'm putting him on the spot here, but I know he'll do it. Is to just get him those questions and he'll forward them to me, and we can, work through it with everyone. Because believe me, we get challenged too by our own grantees where we think, oh, we've done this a million times, and then you've got to think a little bit differently because of the prepare for, prevent, and respond to piece of it.
Am I correct that you have another 2:00 call? Because if not, I want to ask you if my idea is eligible.
No, I'm good. I'm good today.
Okay, great. For those of you who've been on other calls and heard me say that I want somebody to do this, I apologize that you have to hear me talk about it again. So one of the things that has sort of come up in a number of communities in terms of concerns related to rolling out ESG prevention dollars is that the housing stock in which folks may be living in who need prevention don't meet housing quality standards or habitability standards. And so my question is, based on everything you said, I believe this would be eligible, but I would love to get confirmation of that and then hopefully have somebody on the call say that they really want to do this too because it's a need in their community. But could there be sort of a blending or a partnership leveraging of dollars between ESG to provide prevention, but also CDBG to bring the housing where folks are in need up to standards? I mean, I think there's a lot of reasons to look at this model. One, so that somebody can stay in their housing if that's a good fit for them, but also in an effort to build a partnership with the landlord and hopefully have that unit remain available long term as a habitable unit. Then hopefully if those folks do move, it can be used and leveraged to house somebody else with homeless assistance dollars.
So that one is a tough one because we have some folks who are coming in to say we want to rehab homes so that elderly can stay in their homes and not have to go to nursing homes. And the question that I posed, and I didn't get a good answer, so with our other grantees, so I have to pose the same thing, is how would this differ from a regular rehab program? And that's the struggle with this type, is that the housing needs to be brought up. We have pretty specific standards for having a home, you know, that we put dollars in to meet code. And so how do you say it's different now? Are we putting more people in? Do we have a greater lack of units out there? I think we have to think through, and I'm not saying no, but I want to talk through this with, you know, folks that I work with, and how do you make that work? Obviously, I would assume these are landlord units.
Yes.
Yes. So you'd have to have some rent restrictions that occur because of the infusion of our funds, but it's for, I think, a very small term of like 5 years that rents must remain affordable. Historically, in our regular entitlement program, units of local government are hesitant to work with landlords, only in that they feel that they are already in the business of making money to keep those units up. So they don't want to give them grants. I'm just saying that has historically been a mindset that we probably have to work on. And I don't know what you folks are seeing out on your side, but I know that that's typically a response that we get back from units of local government in the rural areas. They don't see giving a grant to somebody who should be managing their properties better to be able to keep them up over providing it to a homeowner or to their public works project that, you know, benefits a greater population base. So I'm going to write that one down, Lee. I want to think through it. I want to think through how we might be able to describe that as different than a typical rehab, because that's what we need to do.
Right. I mean, my first thought is it's different because if somebody is instead going to an emergency shelter, they will be at risk. And if there is no emergency shelter capacity or other things related to that, that just the loss of housing could result in a public health risk. But I need to put more thought into that too. That was my first like instinctual reaction to it, which may not pass muster. So I'm going to put more thought into it as well. Then maybe you and I can chat.
Yes, and we will certainly, you know, as I said, that we're on these different calls with other states, and some states have put out there some interesting things that they're doing. So there could be some who have historically done something like this, or are thinking about it now. So we'll also put it out there to see if anyone is that would help us be able to help you sort of design something.
That's great. It's all theoretical right now, so I think that you know, with the infusion of these dollars, I think that, whereas somebody may have been seen as ineligible for prevention in the past, I think if we can sort of blend funding sources to do interesting things, some folks may be eligible in ways that they were not before.
Oh, sure. Yes.
Anybody else have a question for Donna?
Can you hear me?
Yep.
Oh, great. Donna, may I ask you about the income requirement? So my understanding is that, say perhaps 2 months ago, you wouldn't that's funded through CDBG. Can you talk a little bit about that? Because if today I meet the requirement, but say 3 months from now, my income increases again, like do you foresee any problems being that people's incomes are kind of in flux right now in some circumstances?
Oh, sure. And so here's what we know again from listening to what HUD has had to say. So people, and this is what we're telling our own CDBG grantees. So if you're providing services and people come in at this moment, we always do a projection of income. So what is the likelihood you're going back? A lot of people do not know. They just don't know if their job is going to pull them back, if they're going to be without a job, if maybe something better. You don't know. So at the point they become eligible for the service and are provided that service, if projecting 12 months forward, we look at that point in time. Okay, so that's what we're saying. I would think, though, that if you were providing a service, and let's say 6 months down the road, that family was still receiving services, but you knew everything was back together, I would probably say you probably ought to remove them from the them down. But if they come in and say, hey, well, we got our jobs back, we're working again, this is really great, thank you very much, I think at that point, when you know something, then you might have to relook at it. But we're just at that point in time when they come in and get the documentation that they, this is their income for that family size at that point in time projected forward.
Great, thank you.
Mm-hmm. And I'll just put a plug in. We are having an income determination. It's typically, based on how direct benefit activities like housing, rehab, or direct services. And I think it is next week, starts one of them. But you should also get an invitation, I believe, to take advantage of those. Yes, and I think we're going to talk a little bit about, how COVID-19 is impacting that. And that is Wednesday, June 17th from 2 to 4. So if you haven't gotten it, I'll talk to Kathy about it, because I know we had talked about sending it out to ESG recipients, so I thought it went out to everyone. So I'll mark it down just to check.
Questions for Donna? Okay. Well, Donna, thank you so much. Really appreciate your time, and hopefully folks will be thinking about how to access and utilize these funds to push forward the needs that they're seeing in their community, and we'll reach out with more questions. So thank you.
All right. Thank you all. Have a wonderful afternoon. And like I said, just if you have anything, the housing rehab on rental, and I'll check with Kathy about the distribution list for our income determination webinar. We know for like March 16th in person, and we've had to reschedule all of that. So unfortunately, we're doing like 5 pieces of that 1-day training over a couple weeks period. So we know it's a busy time for everybody, but we got to get it in there. So, okay.
Sounds great. Thank you.
All right. Thanks, everybody. Bye-bye.
Bye. All right. Lauren, can you change to the next slide?
Yes. Sorry, I feel like I just stopped. Did I stop presenting? Do you still see it?
I do.
Yeah, I can still see it up, Lauren.
Sorry, something just went wonky. I'm gonna stop sharing and reshare. Okay. All right, great.
I don't know about anybody else, but I can't see your screen yet. Oh, here it is.
We good?
It's loading.
Oh.
Here it is. Okay. You want to take it away?
Sure. So we sent an email out about this last week, I think. The days are running in, the weeks are running into one another.
It was last week.
Okay, last week we sent an email out about HUD publishing another memo. So their first was back waivers that are program, COC program, HOPFLOW program, and they published another one on May 22nd. So we emailed folks about it, but we wanted to reiterate information included in that memo. There's a link here for folks. And Brendan, feel free to jump in. This is the ESG portion related to that memo. So pretty much HUD has extended, through this May 22nd memo, they extended all of the waivers that were available to the traditional ESG program to the CARES Act ESG program. So all of those waivers are now available for the ESG CV funding. A reminder that DCD is the ESG recipient, so DCD would have to communicate with HUD about using the communicate to their subgrantees about that. But if you want to look through the memo that's there, they also extended the waiver that is available for monthly case management. So HUD is encouraging that folks continue to do their minimum monthly case management, but in instances where it's really not feasible to do that, folks can advise HUD they're going to use a waiver. Again, that would be DCD. They did communicate with HUD when the March 31st waiver was posted. They extended that for an additional 3 months. So the initial memo was your requirement to conduct monthly case management. You can waive that for up to a 2-month period in instances where you really can't get out to see your clients. That's now extended an additional 3 months. I don't know if Brendan wants to add anything to that. Wanted to make sure everyone's aware.
Yep, and I'll just say we did already request the waivers to be applied to the ESG CARES. We had to send in another memo request to HUD, and we have done that. Typically, they've responded really quickly. I didn't send it, so I don't know what the status of that is, but just know that it will be applied once the CARES awards are made.
Great. Okay, and so COC program, in this memo, HUD extended, so the rapid rehousing monthly case management requirement, so that was extended for COC programs as well. So again, if you can provide your monthly case management, of course HUD is encouraging that, but if there are instances because of COVID-19 where you can't get out to your clients, you can't provide that monthly case management, there may be technology issues, accessibility issues, that memo has been extended for an additional 3 months. The other waiver in HUD's most recent memo addresses the 24-month cap on rental assistance. So COC funded rapid rehousing, if you're COC of 24 months of rental assistance. Of course, it's not designed that everyone's getting a blanket 24 months of assistance, but you can provide up to a maximum of 24 months. Because of COVID-19, perhaps households have lost their income, things are changing. So if you have households that are approaching that 24-month limit, you can contact HUD about using this waiver, and you can provide them with additional months of rental assistance. So if this applies to you, definitely review the memo. There's language in there about what type of rationale you have to provide, and there's language in there related to how many more months of assistance you can provide. So, and you'll see here on this slide, it's up to 3 months after kind of public health precautions are lifted in your community. So that's going to look a little different depending on what's going on in your community. So just a reminder that if you intend to use any of the COC waivers that are available to you, that you have to notify your local field office. So there are special email addresses set up for Philadelphia and Pittsburgh, and you have to notify them no less than 2 days before you use the waiver. So if you're trying to use this waiver tomorrow, that's not going to work. You have to give HUD at least 48 hours notice. In some instances, I know Pittsburgh has been really good about responding, but pretty much HUD has said, don't wait for us to respond and tell you we received it. If you sent it and it's been 48 hours, you just had to notify us. You don't have to hear back from us. So, if you've waited your 2 days, you can now use your waiver. You just had to notify them. Don't wait for them to respond because they might not, given all that's going on. So you have to, there's also been some guidance related to documenting the use of these waivers. So at the client level, at the recipient level, considering for future monitoring. So Brendan had posted on Workplace, we emailed out as well last week. The Philly field office had put together some tools that are helpful for folks when thinking about documenting use of waivers for client records. So I encourage you to, if you're developing your own internally, or maybe you already have, or if you haven't, to take a look at those tools, tweak them however you wish, but they seem to be helpful. And then email us with any questions. Let us know if you have any questions or concerns. We'll try to answer as best as we can. Yeah, and this is not related to the waiver, I think next, amendments. So waivers.
Lauren, if you don't mind me, I'm just going to
Sure.
one moment. This isn't really related to the waiver, but I did post new contact lists for the CPT field or the CPD manager field offices, because they said that your grant manager for COC funding may have changed. So I did post them on the East and Western COC pages. Especially if you're on the Western COC, go on and make sure that you know who your CPT officer may be, because it could have changed. So again, I did post those to the Workplace. If you want to go and check those out, make sure you have the correct contact information.
Great. Okay. And then the expedited grant amendment process. So just a reminder that to respond to the COVID-19 crisis right now, HUD has created an expedited grant amendment process for COC funded providers. So it covers these 3 categories. Okay, so if in order to respond to COVID-19, you need to create a line item that wasn't originally in your grant, such as supportive services, you would use this expedited process to do that. Or if you need to move funding between different line items, so say you have an increased need, your clients have an increased need for supportive services, but you have some unspent rental assistance, you can request to shift some money from rental assistance to supportive services. And then the third eligible amendment is related to extending your grant. So really important to recognize that if you are interested in order to spend down funds, this is going to permanently change your grant cycle. So say your grant is due to expire June 30th. and you request a 2-month extension, your permanent grant cycle, it will change permanently from July 1 to June 30th to September 1 to August 31st, 30 days past September, April, June, and November. Yes, 31. So we're encouraging you to reach out to us if you want to talk through that, just to get like a second set of eyes. Any questions, process that out, because the other two above, they're temporary. They'll change for this current grant, but then everything will go back to as it is with your 2019 grant, subsequent 2020 grant. But the third one, extending your operating year, that is going to permanently change your grant. So there's really a lot of budget considerations that you want to think about when considering that third amendment. So there are some email addresses set up for Pittsburgh and Philly, and we ask that you copy the COC when you submit these grant amendment requests, so that we're kind of in the loop about what's going on with your grant and your budgets, et cetera. And again, reach out to us with any questions. Best way to move forward. If you have some underspent funding and you're thinking about ways to move things around, what would be eligible, or if you're thinking about it period, we encourage folks to reach out, and we're happy to assist as you think through that. Anyone else? Is someone?
Are you ready to go out? 23.
Just a reminder to mute yourself if you are not talking. I think there's some background noise. So we have a few minutes left. So as community start in, wanted to provide folks with some resources. The CDC has put a checklist out. They've updated their COVID-19 symptoms. There's more information being learned about COVID-19. So they recently updated some of the symptoms. So if within your program, you're still using the COVID-19 symptoms that the CDC put out, say 2 months ago, definitely encourage you to visit the page. So these links are all here for you. So, and we detailed them here for folks just to be aware. I think it's really just important as we do start to open up and as people, there's going to be more movement, greater movement within the community, that folks are aware of the CDC's updated symptom guidelines for you to be thinking about. And of course, these would be kind of emergency warning signs if people have, sorry, I forgot some folks are on the call, not logged in, I can't tell. So the updated symptoms are fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle body aches, headache, loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. So it's a really more expansive list of symptoms than was originally put out. And again, as we are learning more about COVID-19, we are being provided information, and the CDC will continue to update those symptoms for folks so that everyone is aware. And again, if anyone's really having trouble breathing or persistent pain or pressure in their chest, confusion, inability to stay awake or wake up, bluish lips, obviously signaling lack of oxygen, those are really emergency medical situations where we want to get folks emergency services as soon as possible. The CDC also, there's a link again in a previous slide. They have a checklist out for folks to be considering during this time as communities are reopening. So really pushing home the importance of continuing to follow guidance. This isn't a time to really pull back or relax measures. We really want to stay aware of the COVID-19 situation in your community. You want to keep that connection with the local or state health department that you created during this time, to keep that communication open with them, continuing to post things around your facility, advising people about the symptoms or the ways to cover their cough or hand washing. So continuing to really message all of the measures that you've put into place, physical distancing, cloth face coverings, disinfecting high touch areas, hand washing, etc. So really, CDC is focused on ensuring that people continue the measures that we've put in place at this time, as well as continuing screening people and maintaining those systems that we've put in place to isolate and or quarantine folks when they are symptomatic. If you have clients and or staff who are in that high risk category because of their age and or their pre-existing conditions, really continuing to try to have those additional precautions in place for those folks to protect them. If you've stopped some of your, say, if you are a rapid rehousing provider or permanent supportive housing provider, and you've stopped some of your mental health or substance use services, starting to think about how you resume those safely for folks. If you have some non-congregate sheltering in your communities, in hotels, starting to strategize around how to rehouse people, move them into permanent housing out of those locations. So there's more detail at the CDC checklist link that's provided in the PowerPoint slides around these kind of main categories of recommendations. And then last but not least, this Wednesday, there's going to be a targeting homeless prevention in the midst of COVID-19 webinar in the afternoon. So the link is there. I can't recall if you have to pre-register. Some of HUD's stuff, you don't have to pre-register. You just log in when the time comes.
This one is just log in.
Okay, great. HUD's also put out some landlord engagement resources in the time of COVID-19. And then most recently, I think on Friday, perhaps, this new page. I learned about it on a HUD call on Friday. There's a new page created. It's called Disaster Response Rehousing. It was created by some HUD technical assistance providers, and it really is like a compilation of everything. It diagrams all parts of the homeless response system, so it touches on coordinated entry, on shelter, on rapid rehousing, on permanent supportive housing. And when you click on all of these icons, it takes you to pages where it provides you with information about like COVID-19 specific funding for these aspects of the homeless response system, some best practices for these parts of the system, as well as then community examples. So really great new webpage. I highly recommend going there. Again, it touches on all the aspects of the homeless response system and provides kind of organized information for folks for all those different parts. And that's it. I know we're at 2:29. A reminder, you can unmute yourself if you're logged in by clicking the microphone or *6 if you're on the call. If anyone has any questions, concerns, if you are reopening in your community and you want to share with folks about how that's going. And Leah, I don't know if there was anything else you wanted, any guiding questions for folks that you were curious to hear from people about. And now I'm going to stop talking.
No, I think we just want to make sure that we are clear about what additional guidance you all need. If there are topics that you would like to see covered or issues addressed during next week's office hours, we would want to be responsive to that. Hopefully next week, perhaps we can do an overview of the homeless prevention webinar that HUD is doing on Wednesday. And perhaps also, if you didn't get a chance to see their rapid rehousing webinar last week as well. I don't know if that folks want to type in, if yes, a summary of what they presented would be helpful, or you saw it and you don't want to hear more. Or if you have any questions today, that'd be great to ask away. I'm going to assume nobody jumping in means that nobody has any active questions. I know there was a link earlier in the PowerPoint for submitting questions via the online survey. So if you have questions come up or thoughts, please let us know, and we will try to be responsive to those next week. So thanks to everybody for your time, and we'll talk to you next week. Thank you.
Thank you.
Thanks, Lee and Lauren. Appreciate it. Have a good
Thank you.
afternoon.
You too.